Men's health is in crisis. Men are dying on average 5 years earlier than women, and for largely preventable reasons. A growing number of men, around 11 million globally, are facing life with a prostate cancer diagnosis. Globally, testicular cancer is the most common cancer among young men. And across the world, one man dies by suicide every minute of every day, with males accounting for 70% of all suicides. Helping men live happier, healthier, longer lives is what motivates me to participate in Movember, especially mental health and suicide. I do it for lost friends like Cam and Damien. I've lost too many dear mates too young. I know this is a rather pathetic moustache, but it's also a great conversation starter. A mobile billboard for men's health. From humble beginnings in Australia, Movember has grown to become the world's leading men's health charity, with the Mo campaign and health programs running in over 20 countries. This year, the Movember campaign is in full swing again. The iconic Mo has once again sprouted up from behind face masks right across the country, bringing back a bit of fun into our lives. Much needed fun, it needs to be said. People are also participating in Movember by pledging to move 60 kilometres over the month for the 60 men we lose to suicide each hour across the world. Others are hosting Movember parties or moments, all in an effort to raise funds and awareness for men's health. This year is especially important because the last 2 years of pandemic has taken a massive toll on the mental and physical health of men. In Australia, suicide is the leading cause of premature death for men, but it's not just mental health. Disruptions caused by the pandemic have played a role in delaying consultations and treatment for those with prostate cancer and testicular cancer. So this Movember, we are encouraging all Aussies to donate to an important cause to support all the fathers, brothers, sons, uncles, nephews, friends and loved ones in their lives. Let's all come together to change the face of men's health. To donate or learn more, please visit Movember.com, or to support my little moustache, go to Movember.com/Nick Reece. Michael, were you getting behind the Mo cause this year?
Not in the physical sense, but I'd done it once and it was a terrible look, I must admit. So I'm more than happy to donate money to brave people like you. But look, it's a tremendous cause, and as you say, it's from humble beginnings. It really has now gone global and taken the world by storm. I think here, if we can just sort of branch out slightly from this as the core issue, we just had Remembrance Day on Thursday, and when we speak about men's mental health, and particularly the issue of suicide, one thing this country is still, I think, trying to come to grips with and deal better with is the mental health of our armed service men in particular. And it's a discussion that does get raised from time to time, usually around Anzac Day and then Remembrance Day, and then there's a lull in not interest but focus, particularly throughout the media, throughout the other part of the year. If Movember maybe is another example or an excuse to refocus on that particular aspect of men's health, then I think it would be particularly important this year, most certainly after the end of what was 20 years engagement in Afghanistan, and having spoken to a number of people concerned with that particular engagement, I do understand that a lot of our personnel who served there are feeling particularly aggrieved at seeing what has become of that country after 20 years of Allied involvement there. So I just wanted to add that to the discussion.
I'm really glad you have, Michael. Indeed, one of the areas which Movember focuses on in the mental health space is mental health issues for veterans and first responders, recognising, as you have very well articulated, that there are special challenges there. So whether that's in Australia, the US, the UK or Canada, Movember has been a very strong supporter of mental health programs to help those men, those veterans, help get on with their lives when they return from their duty of service. Emile, do you have any fathers, sons, loved ones in your life that Movember means something for?
Well, I'm thinking that tomorrow morning my partner may wake up without his beard and just the mustache. We'll see about that. No, I have full support for this campaign. I think the last 2 years have been particularly hard on blue-collar workers, people that have lost jobs, people in the construction industry that have lost jobs. A lot of men are suffering, a lot of people are suffering, and so I think that it's really important. This campaign is particularly important right now, and so really appreciate your mustache there. And yeah, no, absolutely, full support.
That's great. It's not too late for that special man in your life, Emile, so you tell him you want to run a Movember-style shave down tomorrow morning. Caleb, any thoughts on Movember? You've got a pretty handsome beard there, my friend.
Yes.
Fancy a trim?
No, not really. I think my girlfriend might leave me if I shave it off because she's a little bit older than me and it might remind her exactly how young I am. But you make a really good point, and I think this year in particular we need to take Movember and the broader discussion around men's health as an opportunity to say everything that you've put off doing during COVID, you need to go and get checked now. Because if you were ever hesitant to have your prostate checked or any other health issue you might have, be it man or woman for that matter, COVID really was the greatest excuse to not do anything about it. Now, I'm on the advisory committee of the Breast Cancer Initiative, which doesn't always apply to men, but it does sometimes apply to men. And some of the data we've been looking at shows very clearly that for women, their rate of screening for breast cancer has plummeted. And I'm sure this is true, I'm sure this is true of most issues of health when it comes to men as well. And prostate cancer, which as you say is so prevalent, is something that if caught early is a very easy cancer to catch and fix. But if you don't get yourself checked, it's not possible to do that. And what I'm really worried about is that we're going to have in a few years' time this pandemic of other illnesses that have cropped up because people during COVID and lockdowns didn't take the time to go and get themselves tested or go and get themselves checked or said, I'll deal with this when lockdown ends, and then they eventually don't do it. And they are the things that lead to irreparable damage to your body and sometimes even death. So we need every man who hasn't had a prostate check or has a niggling little issue that he keeps saying, I'm not going to go to the doctor. This is the reminder, go and do it now, because it could seriously be a case of life and death. And the excuse of, the hospitals are really busy with COVID, that's not an excuse. You've got to go and do it, because think about your loved ones, think about your wife or whoever. They want you around, and if you can't take care of yourself, who's going to take care of them?
Well said, Caleb, well said. Well, we've had our view on population growth, renaming history and men's health. But you can let us know if you agree or disagree. Simply use the hashtag #InMyView on Twitter, or you can email your say at skynews.com.au.